So in terms of the new technology, we're always incorporating a lot of new things in the office. One of the newer equipments that we've incorporated is called a scanner. This is an iTero scanner. There are many different kinds of scanners on the market. What it does is it takes thousands of photos consecutively very quickly from a wand that is, goes around in the mouth, and it records everything in the mouth. And it's then used to, for the patients to actually see up front what, their teeth look like. And it's also used in many different ways in terms of, clinically, to be able to, let's say, do Invisalign. I get to send that, file then to Invisalign and be able to create a treatment plan, which is then used to create, manufacture the trays and do the whole aligning process. It's used in restorations, as in, if I'm doing a crown or if I'm doing a veneer, I can scan it in and it will go to the lab directly, as opposed to having impression materials in the mouth. A lot of people hate, that feeling of having all that, group in the mouth, and then having to mail that in, which takes, could be, up to 2-3 days. It just directly goes to the lab. The lab gets it within about 15-20 minutes, and then they use that as a model to create the restoration and mail it to us. So it does wonders. It's amazing when it comes to dentistry. You can also use it to compare and contrast. So a patient comes in, today, and we take a scan. They come in again in a year, and I can show them what's changed. Do you have more recession? Is there more? Is there so much clenching that the teeth are kind of grinding down to the point that we need to do something about it? Was an issue there before that that we kind of didn't address, and now we really need to address, or did something new develop? So it gives us a lot of information that can be stored and be used as either a baseline or for actual dental work over time. So the other piece of equipment that I really like using is a laser, which is used mainly just for soft tissue. It's not to cut through actual tooth structure. There are lasers that cut through tooth structure. This is not it, but it does help me in terms of any kind of modification I need to make to the gums. So let's say a patient comes in and they're doing veneers, and one of the teeth, the gum is a lot lower than the other one. It doesn't really match. I can use my laser to kind of recontour that tooth and even things out. So when I do the veneers, everything will look a lot more harmonious and nicer kind of eventual outcome. It can be used in there are many different things it can be used. It's used in ulcers. It helps heal things a lot faster. It cauterizes the tissue, which means it kind of prevents the cut and the bleeding that is caused by a blade, and it stops the bleeding right away by way of cauterizing the tissue. So let's say in an implant case, somebody got an implant and they're coming in to place the crown part on top of the tooth. I can use the laser to recontour the gum and get it ready for that crown. And if I'm doing this with a blade, I'll have to send the patient home to heal and then come back again after a while. But with the laser, I don't have to do that because there's no bleeding on the side. It's a clean side. I could, take that scan and send it in and get, everything back a lot quicker this way. When it comes to doing root canals, we have probably the most advanced system. It's a system. It's a way to fill the canal after it is completely cleaned out from the nerve and the blood vessels, and it kind of fills it from the bottom up and makes sure there are no voids, no issues as we're filling the canal up. So it's one of the newer equipment that are out there, for root canal treatment. The treatment is a lot more effective. The risk of failure is a lot lower. The site is a lot cleaner, and no void. The fact that there are no voids means there are no chances, or less chance at least, for bacteria to kind of house itself in there again and restart an infection or cause any other issues, in terms of root canal failure in the future.